Glaucoma is a disease where there's damage to the optic nerve at the back of the eye. The optic nerve is the cabling that takes the images from the eye and sends it to the brain. In glaucoma, vision can be affected, initially peripheral vision and then more later central vision. Glaucoma is the most common cause of irreversible blindness worldwide. Many people with glaucoma won't even realize they have glaucoma, and that's because it's often not noticeable until the disease is very advanced. The first symptom will be loss of the peripheral or the side vision. But with very advanced glaucoma, not only is the side of vision affected, but also the central vision is affected as well. And because glaucoma is often asymptomatic in its early stages, it's very important for patients to see their eye doctor to have regular checks looking for glaucoma. Since many patients won't have any symptoms in the early stages of glaucoma, it's very important that patients undergo screening looking for glaucoma. This is particularly important for patients over the age of 65 and those patients who have a family history of glaucoma. The main ways that we diagnose glaucoma is with an examination by an eye doctor of the back of the eye of the optic nerve, a check of the pressure in the eye because most patients with glaucoma have higher pressures, and a check of the peripheral vision that we do with a test called a visual field test. Diagnosing glaucoma can be complicated and it's not always simple. And for this reason, in many cases your doctor will need to see you on multiple visits to look for progressive damage to the optic nerve so they can diagnose glaucoma. The main way that we treat glaucoma is to lower the intraocular pressure, or the pressure inside the eyeball. And that's important because by lowering the pressure inside the eyeball, we can prevent ongoing damage to the optic nerve known as glaucoma. That's very important because there's no way of reversing the damage that has already occurred to the optic nerve. All we can do is halt further progression, and for this reason, seeing your doctor regularly to check and manage your glaucoma is very important. There are three main ways that we treat glaucoma by lowering the intraocular pressure or the pressure inside the eye, and these include eye drops, laser or surgery. Your doctor will discuss with you what's the best option for you. Eye drops include a range of different medications that have to be given regularly into the eye. So remember, the drops are only going to work if you are compliant and using your drops correctly. Sometimes laser can also be used to lower the pressure inside the eye and prevent further progression of glaucoma. These lasers can often be performed in the clinic and do not usually require coming to hospital or being admitted. There are two main lasers that we use. The first is known as SLT. And SLT, in many cases, can reduce or even prevent the need for patients to use glaucoma drops. The second type of laser is called YAG or YAG. And the YAG laser is used in specific types of glaucoma where the drainage outflow pathway of the eye is very narrow. And the YAG laser helps to open up a new pathway to allow fluid to exit the eye. Sometimes either eye drops or laser are still insufficient to lower the pressure in patients with glaucoma. And in this case, surgery is usually required. Surgery may include operations such as a trabeculectomy, a glaucoma drainage device, or a newer device which has been coming onto the market over the last few years, known as MIGS or MIGS. And MIGS includes a range of products such as the iStent, the Zen, or the Hydrus. Cataract surgery in itself can often lower the pressure inside the eye, and so cataract surgery can often be useful in patients who have glaucoma. That's particularly important in certain kinds of eye conditions such as angle closure or a condition called pseudo-exfoliation. It's important that patients undergoing cataract surgery, if they have glaucoma, the doctor often needs to use special techniques or special management before or after the surgery. It's important to talk to your cataract and glaucoma specialist for the best management for your eye.